The COVID-19 pandemic has wreaked unprecedented havoc on children, families and communities around the globe, disrupting vital services and putting millions of lives at risk. Now, since March, attempts to avert the global health crisis have been seen nationwide. School closures in more than 194 countries. In South Africa, as other African countries, teenage pregnancies rose during COVID-19 lockdown. We look at how teenage pregnancy threatens to block more than 1 million girls from returning to school and, of course, other aspects of their life. Phinah Kodisang is the Chief Executive Officer of Soul City Institute for Justice. She joins us now. A very good evening to you, Phinah. Thank you so much for speaking to us. I'm sure these figures are not alarming to you. It's been said over and over again by not only social scientists in other countries, but in South Africa as well, the warning of the rise in gender-based violence.
Yes, and thank you for having me on your show. These numbers come as no surprise to us. I think even before lockdown, we have been, as an organization, very vocal about the rise in the number of sexual violences and the rise in gender-based violence and femicide in the country. And our worry has always been that with the lockdown, now we are locking women with their perpetrators in houses where at the time we were at level 5, they could not go out to get help. And we've seen that the trend kept growing, even different levels of the lockdown.
So, and I want to just zone in on the issues, because we've been asking our viewers, what can we do to better protect the girl child? And obviously, if you're not exposed to certain situations, you would make certain assumptions. And as you interestingly said, that young girls have been locked up with their perpetrators. Are these the only reasons? And I'm not saying that's not important. I want us to focus on that in just a moment. But broadly, has it been mainly due to sexual violence and abuse and exploitation?
Definitely not. But I think we shy away from calling out violence. We are quick to say these young girls are having consensual sex. And of course, some of them are, but we know that a majority of them are not. You know, teenage pregnancy is based on a number of reasons. It could be being raped at home, being raped even in school, that we consider a safe space for young women. You can be raped anywhere you find yourself as a young person in South Africa, not only in South Africa, the world alike. So I think it's problematic if we just want to talk about young people. And I noticed one of the notes or the comment that was made by one of your viewers who are saying they are having unprotected sex. You know, not all of it is consensual, and we need to know that. And of course, those that are consensual, we need to also note and do something to make young women aware that they don't necessarily have to fall pregnant when there's contraceptives and when there's condoms that can be used to protect themselves.
And I want to talk about that, sexual exploitation, because people are also very, you know, one-track minded in their understanding of where consent begins and ends. They will look at two people who they believe are peers. And I'm not talking about outright rape, but the rising socioeconomic desperation. Let's also talk about how that plays into the dynamic.
So you can easily be manipulated if you are poor, because you are thinking about your stomach, you're thinking about a meal for the day. And we know how a lot of young women are taken advantage of. So in exchange for something to eat, you are asked for sexual favors, just like in the workplace where for some women to get promoted, there's sexual exchanges, and that is also problematic. But let's talk about these young women. Our country says the age of consent is 16. Even at that age, you are still very young to be making serious life decisions. You know, so if somebody takes advantage, somebody older or even somebody your age who doesn't know any better, who might also need education around what is the best way to have fun as peers, because I think at that age you are thinking you are just having fun without realizing the consequences. So we need to educate, and I know that we do have comprehensive sexuality education, but let's be honest, not all teachers are comfortable teaching about sex.
And Phinah, we'll talk about We'll address the issue of family planning in just a moment, but you're speaking about the need to educate, and a thought just came to me. There is something that I hear so often and I find so infuriating here in South Africa, that these girls have sex and babies in order to get child grant money. Can we just talk about that for once, how it is really impractical for young teenage girls to get pregnant just for 350 Rand or whatever amount it is that they would get as a result of that pregnancy?
I can't remember which year it was, but a study was done to disprove that notion, because it was something that was thrown around, and a study was actually conducted, and it actually proved that there is no relation between the social grant and the rise in teenage pregnancy. Like I said, it's easy in South Africa to problematize young women, to choose the low-hanging fruits in terms of dealing with issues. And because rape and gender-based violence is something that we still are not comfortable as a country to deal with, we ignore those facts. We deal with, where we know that a young girl was in a relationship and she gets pregnant, we tend to use those examples more than we use the examples where rape has been perpetrated on young women, where consent was not considered, especially relationships where adults are involved with children.
And I want to talk about adults and children.
Let me just finish that sentence. So like I said, the age of consent is 16. And when you have a 10-year-old, a 14-year-old giving birth, you should start worrying.
Exposure to sexual images and behavior that is unsupervised, and by this I'm not suggesting that it ought to be supervised, but we have been talking about family planning, so those discussions, but it's also been said by psychologists that children at a young age who are oversexed is also as a result of sexual abuse. So let's talk about that as well, so that people understand that it's not necessarily voluntary.
Yeah, you are right. It's not always voluntary, but COVID-19 not only affected going to school, but clinics also, services that young people access in clinics were also affected. So they didn't necessarily have access to their contraceptives. Even when they could go to clinics, because of social distancing, the numbers that could go into a clinic per day was limited. And I think it's still the case even today. So we need to deal with the structural issues. They affect so many other things, but I want again to call out all of us in terms of how easy it is to just talk about relationships that young people are involved in as the reason why there's so much teenage pregnancy, without necessarily looking at statutory rape and calling it what it is. So reporters would say 10 to 14-year-old deliveries in clinics has risen, instead of saying, if it's that age, we know that our law says it's statutory rape. When are we calling it out? When are we doing something about it? So there is many layers to the issue, and I don't want to give people impression that it's just one-sided, right? I said the structural issues that we need to look at. We also need to look at gender-based violence, especially in these 16 days, because we know that it is a pandemic in South Africa.
Phinah,
and we can't.
I want us to make a date to talk about it a little bit more, because I think it's such an interesting discussion. And as you mentioned, we know at some point when the education department started talking about sexual education at a certain age, there was an uproar, an outcry, and I hope we have a conversation about it at some stage, the importance thereof and what are the lines that can be crossed and whether or not they're worth crossing. Thank you so much. Soul City CEO Phinah Kodisang, speaking about our discussion of the day. It's our question of the day. We're asking you, how best can we protect the girl child? Teenage pregnancies rising during COVID-19 lockdown. You've heard her outline the reasons behind it, so share your views.